Hello everyone, welcome. Today we are going to talk about mechanics of breathing and compliance. So in the mechanics of breathing, let's first talk about the muscles that are involved in inspiration and expiration. So among the muscles of inspiration, the most important muscle is diaphragm. So suppose this is your abdomen and thoracic cavity and those are your diaphragms. So whenever the diaphragm contracts, they push the abdominal content downwards and they increase the volume in the thoracic cavity, and also they lift the ribs upward and outward, so ultimately increasing the volume of the thoracic cavity. This is the main mode of respiration during quiet breathing. And whenever someone is exercising or someone is in respiratory distress, he uses external intercostal and accessory muscles to help him breathing more. And the muscles of expiration are actually normally not used because commonly expiration is passive, and the passivity is actually due to the elasticity of the lung and chest wall system, which helps to return it to resting state after inspiration. And you can only use expiratory muscles during exercise or when the air resistance is increased because of disease like asthma. And the muscles that you can use for forceful expiration are abdominal muscles and also the internal intercostal muscles. Now let's talk about the very important point in respiratory system, which is compliance of the respiratory system. So compliance is actually described by the following equation, which is compliance equals to volume change divided by the change in pressure. So C is compliance, V is volume, and P is pressure. Compliance actually tells you how well the volume in lungs or lung chest wall system complies to changes in pressure, or how well the volume changes with changes in pressure. So it actually describes the distensibility of the lungs and the chest wall, and it is the slope of the pressure volume curve. So if we put some curve here, like this is here is the volume and here is the pressure, and if we put a graph and if we want to see the change of volume and change along with changes of pressure, the curve may be like this or maybe like this. So this curve has a higher compliance because it is steeper, and this curve has a lower compliance because it is not steep, it is a bit flatter in comparison to this curve. So compliance is actually the change in volume for a given change in pressure, and the pressure refers to transmural or transpulmonary pressure. And transpulmonary pressure is actually the pressure difference across pulmonary structures. So here you can see the compliance of the lungs. So this is the volume and this is the pressure. Suppose we are increasing the pressure from 0, and it will actually causes the volume to increase. So you will have a curve here like that, and the compliance is actually the steepest in this area. So in the middle range of pressure, the compliance is highest. So actually for compliance, the most important pressure is transmural pressure, and transmural pressure is actually the alveolar pressure minus interpleural pressure. If the pressure outside the lungs, meaning the interpleural pressure, is negative, the lungs will expand and lung volume increases, and this occurs during inspiration. So when you are inspiring, you are pulling your diaphragm downwards, and also you're increasing the volume in your chest wall system. It increases the pressure, increases the negative pressure inside the pleural cavity, which causes the lungs to expand and causes inspiration. And if the pressure outside the lungs is positive, the lungs collapse and the lung volume decreases. These kind of things occur during pneumothorax. In the middle range of pressure, the compliance is greatest and the lungs are most distensible. And at high expanding pressure, the compliance is lowest. So the volume does not change much with the pressure, and the lungs are less distensible and the curve will flatten. So here you can see the compliance of the lung chest wall system. So this blue curve represents the compliance of the chest wall system, this red curve represents the compliance of the lung system only, and the green curve represents the lung and chest wall system. As you can see here, the chest wall curve is steeper, and the lung curve is steeper, but the lung chest wall curve is actually a bit flatter in comparison to chest wall only or lungs only. So in those curves you can see the changes in the volumes according to changes in trans-organ static pressure. So whenever the pressure changes, the volume changes too. And the intersection where I put a dot here is the functional residual capacity, and in the line of functional residual capacity, the compliance of the lung chest wall system has the steep portion, so the compliance is greatest at the functional residual capacity. And in case of functional residual capacity, the chest wall system has a negative pressure and the lung system has a positive pressure. This causes a net zero pressure in the lungs, in the lung chest wall system. So due to this net zero pressure, there is no movement of air into lungs or out from lungs. So here you can see from the previous picture that the compliance of the lung and chest wall system is actually less than that of the compliance of lung alone or the chest wall alone. And at rest, which identified the field circle at the center of the curves, which is this. So at rest, this is the FRC. So at rest, the lung volume is at functional residual capacity and the pressure in the airways and lungs is equal to the atmospheric pressure, which is 0. And under those equilibrium conditions, there is a collapsing force on the lungs and an expanding force on the chest wall. So here, this is the force which is trying to collapse the lungs, which is the positive pressure, and this is the pressure which is trying to expand the lung, which is the negative pressure. And at the functional residual capacity, those two forces are equal and opposite. So as you can see, this is the negative pressure and this is the positive pressure. Both of them are equal and they're opposite. So that's why the combined lung chest wall system neither wants to collapse or neither expands. So it remains in the same situation. And as there is a positive pressure in the lung system and the negative pressure in the chest wall system, in between the lung and chest wall you have the pleural cavity. So that's why interpleural pressure is negative or subatmospheric. If you introduce air inside your interpleural space, which is called pneumothorax, the interpleural pressure becomes equal to atmospheric pressure, and that's why the lungs will collapse, which is their natural tendency, and the chest wall will spring outward, which is their natural tendency. And this point is very important to remember. Compliance is decreased in pulmonary fibrosis because pulmonary fibrosis causes diffuse fibrosis in different areas of the lung, and the airways cannot expand as well as they should. In case of pneumonia, the airways cannot expand because of infection. In case of pulmonary edema, the airways cannot expand well because there is fluid in the spaces, so the fluid actually is preventing the airways to expand. And actually in emphysema and normal aging, the compliance increases. The compliance increase in emphysema and normal aging is due to the decreased elastance of the lungs, and the lungs actually is not that elastic, which is as opposed to normal people or as opposed to younger people. So here we have a practice problem. So the lung and chest wall compliance curves for a healthy individual are shown on the slide below. So here you can see the lung and chest wall compliance curves. So this is the chest wall compliance, the black one, and the black one here is the lung compliance, and the blue one is the combined lung chest wall system. Now the question is, which of the following is the best estimate of the interpleural pressure at the point on the graph marked by the red dot? So what is the red dot? So as you can see, the red dot, in the red dot, the negative pressure or the chest compliance and the positive pressure, the lung compliance, are equal and opposite. So this is actually the functional residual capacity. And in case of functional residual capacity, the interpleural pressure is negative because the two forces are opposite and they are creating a negative pressure inside the pleural cavity, and it is about -5 cm water. So that's the answer. We have another practice problem here. A 63-year-old male with recent history of myocardial infarction presents to the emergency room because of an increasing shortness of breath and cough. Physical examination reveals crackles at the base of the lungs bilaterally and a S3 on cardiac auscultation. His oxygen saturation is low. Now, which of the following is most likely accounts for this patient's dyspnea? So what is the most likely cause of this patient's dyspnea? So there are multiple options. I'm picking the right one here. You can pause if you want. So the most important cause of this patient's dyspnea here is decreased lung compliance. Why is so? First of all, what is the diagnosis in this patient? This patient has a previous myocardial infarction which damaged his heart valves or ventricular valves, and this leads to formation, or this leads to development of a heart failure, which is evidenced by the shortness of breath, cough and crackles in lung bases, and also S3 in cardiac auscultation. So this patient actually has acute left ventricular failure, and in case of acute left ventricular failure, the heart cannot pump the blood out of the lungs. That's why the blood actually accumulates in the lungs, which then extravasates, and then this blood goes inside your alveoli. Also the fluid portion also goes into the interstitial space, and when the fluid portion goes into the interstitial space and alveoli, the alveoli cannot expand as well as it should. So the compliance of the respiratory system actually decreases. So decreasing lung compliance is the cause of dyspnea in a patient with ALVF, leading to pulmonary edema. We have another practice problem here. Here we have a 43-year-old patient presenting to your office with chief complaints of dyspnea, and the curve below in black represents the pressure volume relationship in this patient's lung tissue, and the blue curve represents a normal pressure volume relationship. So this is the normal one, which is the steeper one, and we have an abnormal one, which is the flatter one. Now, which of the following is the most likely cause of this patient's symptom? So you can pause here and you can pick your answer. I'm going to the answer directly. So here the diagnosis is pulmonary fibrosis. Why is so? First, look at the volume and pressure curves. So in the volume and pressure curves, you can see that the normal curve is steeper and the patient curve is flatter. So there is actually a decrease in compliance. So as the curve is flatter, there is decreased compliance. And among the conditions presented here, the most important cause of decreased compliance is pulmonary fibrosis. So that's all from me today. Thanks all for watching my video.